Making sure you're drinking about 2 to 3 liters of fluid, ideally water a day, because dilution is the solution to the pollution, right? So drinking more fluids is going to get that bacteria and you're going to pee it out. It's going to help not let it sit around in the bladder very often. Another thing in women who have altered states of estrogen, whether it's postmenopausal, surgical menopause, or maybe have reduced estrogen for postpartum or other reasons.
What about during the second half of the menstrual cycle?
Not necessarily for those specific people, but for those specific times, but because it's pretty short-lived. I guess you could use it, but is vaginal estrogen. So vaginal estrogen, meaning estrogen that's applied in the vagina, either through a cream, a suppository, or a ring, is highly effective in reducing the occurrence of recurrent UTIs. And this is because when you have low estrogen, the pH in the vagina goes up. And the pH in the vagina goes up because there's less conversion of glycogen to lactobacilli, and then those lactobacilli are preventative for UTIs. So essentially, you want to reduce the pH back to its normal acidic pH, and vaginal estrogen is very effective at doing that. In fact, in our clinics, we'll actually check a vaginal pH, to see if there is an indication that their pH is too high, that maybe they do need vaginal estrogen, particularly around like perimenopause, because it's hard to tell just by looking if they are really heading into a lower estrogen state sometimes. And so that's very, very effective and very, very safe. So when you look at estrogen, the Women's Health Initiative way back when sort of made a big stink about how estrogen is related to cancer. However, vaginal estrogen has never, ever been a reported breast cancer, uterine cancer, or any other blood clot, any other adverse event associated with vaginal estrogen. You can get some breast tenderness, some discharge. Those things can occur, but the absorbed amount vaginally is so little that your estrogen level barely goes up. It doesn't even reach premenopausal levels. So it just goes up very slightly in the bloodstream, not enough to create any sort of abnormality. So vaginal estrogen is extremely safe and it's pretty affordable. You could actually use coupons if your insurance doesn't cover it through, GoodRx or Mark Cuban's pharmacy and get it very, very affordably. And it's very effective. It does take about 3 months to work. So, you have to be consistent. You apply it about twice a week at night, sometimes 3 times a week. And it's very effective. The ring you put in once and it lasts for 3 months. But so generally speaking, that's the most effective option for low estrogen states.